Welcome to Raaonline. I am Dr. Sudakshina, Professor of Anatomy. Today we are going to discuss a case which is going to be related with the anatomy of facial nerve. So the case goes like this. A 28-year-old woman at 19 weeks of pregnancy complains of acute onset of loss of expressions on the right half of the face. She denies trauma to the head. On examination, the patient has difficulty in closing her right eyelid, blunting of right nasolabial fold, and experiences difficulty in holding food in the mouth. So definitely this, as you can see in this case, there is a problem with the facial muscles, that is the motor innervation of the face, because he has difficulty in closing his eyelids, right eyelid, and especially one half of the face is involved. So it is looking more so that the facial nerve or the seventh cranial nerve is involved. Now coming to the anatomical aspect of the seventh cranial nerve. So the seventh cranial nerve is the nerve of the second pharyngeal arch. Now we know that there are few pharyngeal arches, 5 pharyngeal arches which will be developing on either side. So if we go to the embryology of the seventh cranial nerve, so it is the nerve of the second pharyngeal arch when there is the development of the head and neck when it is happening. These pharyngeal arches are mesodermal in origin and they have actually one nerve. Every pharyngeal arch will have a nerve and an artery of its own. Now coming to the seventh nerve, seventh cranial nerve, which is also called the queen of the face as such. So this nerve will be supplying the motor fibers. So it is a motor supply to the facial muscles. So that is very important. So that is the opening statement. You should write like that because it is the opening statement is an essay question. Facial nerve comes as an essay question. So you should know that it has a very high motor component. It will be supplying the facial muscles. So facial muscle paralysis is one of the sign of involvement of seventh cranial nerve. Coming to the other components of this nerve, so as we enumerate all the components now, definitely motor component, it is supplying the muscles, but it is also a mixed nerve. So it has parasympathetic component, it has some general sensory component, it has also some special taste fibers which it will be carrying to the salivary nucleus. So the parasympathetic component of the facial nerve is the secretive motor fibers. So it is parasympathetic, as you know, the parasympathetic supply to these glands, so to the nasal glands, to the lacrimal glands, palatine glands, all these glands will be increasing the secretion of these glands because parasympathetic increases the secretion of the salivary glands and also the lacrimal glands, the nasal glands, the pharyngeal glands, whatever the glands is there in the paranasal sinuses are being supplied by the facial nerve. So these are secretomotor fibers. That's why they are called secretomotor because it will promote secretion. So what does the sympathetic do? Then if parasympathetic will promote secretion of these juices from these glands, sympathetic will be reducing the secretion. So sympathetic will actually make the secretions more sticky, more dry because it will reduce the component, the secretory component of this glands, functional component of this gland. So the main function of this glands to secrete the lacrimal glands is to secrete the lacrimal secretions, nasal glands to lubricate the nasal cavity, and also you have the submandibular and sublingual glands, salivary glands which will secrete the salivary secretions. So the main action of these glands are to secrete the juices. So this is being brought about by the facial nerve. So it is a very, very important nerve for the functioning of these glands. So coming to the next component is definitely the parasympathetic or the secretomotor component. Now come to the, please enumerate the components first of this nerve, then it will be easy for you to go through the course and also the branches of this nerve. Now come to the another component which is also I told you to start with. It is a nerve of the second pharyngeal arch. It is a mixed nerve. So definitely it will have mixed nerve. So it will have a sensory component, it will have motor component, it is having parasympathetic components, it is also having special sense functions. So it is a mixed nerve. So coming to the next component, which is general sensory fibers. So this is a very small component of the facial nerve. It is hypothesized and it has been also proved that this general sensation, especially from a part of the external ear, okay, a very small part of the external ear is being carried by the facial nerve. The most component which we are giving more importance is definitely to the motor, the secretomotor and the special sense. There is some very little component of general sense which is being carried from the external ear. Just to have it in our mind, we have to enumerate all the components. Come to the next component of the facial nerve which it carries. It carries the taste fibers. So it carries taste sensation. From where? The anterior two-thirds of the tongue. Now in the tongue, you have the sulcus terminalis, you have the foramen cecum. We divide the tongue into the anterior two-thirds and the posterior one-third. And this anterior two-thirds of the tongue, the general sensation is being carried by the lingual nerve, okay, which is a branch from the mandibular nerve or actually coming from the trigeminal nerve. So that is carrying the general sensation. But what about the taste sensation? The taste sensation is a special sense. It is being carried by the chorda tympani. Now the chorda tympani will join the lingual nerve and it will seem like as if lingual nerve is carrying both the taste and the general sensation from the anterior two-thirds of the tongue. But that's not the case. The chorda tympani nerve is a branch from the facial nerve which will be specialized to carry the taste sensation from the anterior two-thirds of the tongue. The chorda tympani will also carry the parasympathetic secretomotor fibers and it will also supply the submandibular and sublingual salivary gland. So this is the main components of the facial nerve. So once you have enumerated the components of the facial nerve, then you can easily go to the course, the origin, the intracranial part, the extracranial part of the nerve. Because once we know, we have to know that when we tell all the branches, we should cover all these components because these are the functional components of